Hi friends, welcome to the channel Nurses Forum. Today we are discussing about prevention and the levels of prevention. This is one of the most important area in community health nursing. Before going to the topic, those who are not subscribed to our channel, please subscribe. So let us begin. What is prevention? All action aimed at eradicating, eliminating or minimizing the impact of disease and disability. It is called as prevention. That is, whatever the actions we are taking to control a disease, to eradicate a disease or to eliminate a disease, and the actions we are taking to minimize the disease impact and disability, that is called as prevention. Let us see what are the levels of prevention. There are 4 levels of prevention: primordial prevention, primary prevention, secondary prevention and tertiary prevention. We can see one by one in detailed manner. First we can see the primordial prevention. What is a primordial prevention? All action taken to prevent the emergence of a risk factor. In the primordial prevention, our ultimate objective or focus is on risk factor. We are taking all measures to prevent the emergence of risk factor. For example, obesity, eating patterns like high cholesterol, high fatty diets, alcoholism, smoking and the lack of exercise. These are the risk factors for coronary artery disease and hypertension. So in the primordial prevention, we are eliminating the risk or we are eliminating the chance of development of this kind of risk factors. That is called as primordial prevention. So by eliminating the chance of development of this risk factor, we can reduce the development of coronary artery disease and hypertension. There are 2 modes of intervention are included in the primordial prevention, that is individual and mass education. By giving individual and mass education to the public, we can control or we can reduce the chance of development of faulty health habits and harmful health habits and lifestyle. So we can prevent the emergence of risk factors that can be leads to the development of some diseases like coronary artery disease and hypertension. So we can go to the next prevention, that is primary prevention. In the primary prevention, the risk factors is there. Here we are aiming to prevent the emergence of a disease. Here the risk factor may be there and we are here focusing to prevent the emergence of a disease. All actions taken to prevent the onset of disease that will remove the possibilities of occurrence of disease, that is called as primary prevention. It includes 2 types of modes of interventions, that is health promotion and specific protection. First we can see health promotion. In the health promotion, it includes health education, environmental modification, nutritional intervention and lifestyle changes. First one is health education. The health education means we can give any type of health educations to the public, that based on regarding the balanced diet, regarding the environmental sanitation, any kind of health education we are giving to the public is kind of an health promotion. What is health promotion? Health promotion means we are helping the public to enable a healthy life. That is health promotion. So what is the health? In the health education, we are giving a health educations to the public that will help the public to enable a healthy life. And the second one is environmental modification. In the environmental modification, it includes the fire, or for example we are giving a fire safety. We are following fire safety measures. We are following fire safety measures in buildings and institutions to ensure the safety of the public. It is an example of environmental modification. And the next one is enforcing laws like wearing helmets and wearing seat belts, and we are following the traffic rules. These all are the examples of environmental modification to control or to reduce the emergence of a disease. And the next one is nutritional intervention. We are following a balanced diet. It is a kind of nutritional intervention in the health promotion. And the last one is lifestyle changes. We are modifying our lifestyles to enable a healthy life, like good sleeping habits, exercise and good dietary habits. These all are the examples of health promotional activities in the primary prevention. So next we can move to the second mode of intervention in the primary prevention, that is specific protection. What are the examples of specific protection? In the specific protection, we are specifically protecting the individual from particular disease. That is specific protection. What are the examples? Immunization. Immunization is one of the classical example of specific protection in the primary prevention. For example, we are giving a polio vaccines to the children, or measles vaccines to the children. This is an example of specific protection. We are specifically protecting the child from measles. In primary prevention, risk factor is already existing there. Poor nutrition and vitamin A deficiencies are the risk factors of measles. So in the case of specific protection, we are giving a measles vaccination to the child. That is an example of specific protection. And ensuring the safety of drugs and foods. Chemoprophylaxis. In the case of chemoprophylaxis, we are giving some medicines to the individual to prevent a particular illness, like DEC we are giving for filariasis. It is an example of chemoprophylaxis in this case of in specific protection. And environmental sanitation, all environmental sanitation measures like controlling pollutions, or controlling all kind of pollutions like air pollution, water pollution, noise pollution. These all are the examples of specific protection in the primary prevention. So in this primary prevention, we are reducing the chance of development of a disease. So next we can move to the secondary prevention. In the secondary prevention means the actions taken to prevent the progress of disease and emergence of complication. In the secondary prevention, what we are doing, we are taking some measures to prevent the progress of disease and emergence of complication. That means the risk factor is there and disease has been started, and we are taking some actions to prevent the progress of disease, and that so that we can control the complication as well. So what are the modes of interventions in the secondary prevention? That is early diagnosis and treatment. Early diagnosis and treatment, that is one of the most important mode of intervention in the secondary prevention. For example, we are doing screening test. We are doing screening tests like pap smear for diagnosing, for screening for CA cervix, and breast self examination for CA breast, and providing treatment to the tuberculosis cases as a DOTS treatment. And we are conducting school health checkup for early diagnosis and treatment, and all national health programs are included in the secondary prevention. Why it is included in the secondary prevention? For example, tuberculosis control program, malarial control program. In this control program, we are doing early diagnosis and treatment to these particular diseases. So the all national health programs are also included in the secondary prevention. Let us move to the last part, that is tertiary prevention. In the tertiary preventions, measures taken to reduce limit impairments and disability. In the tertiary prevention, risk factor is there, disease has emerged, and the disease is progressed into an extreme stage. So in the tertiary prevention, we are taking some measures to limit the impairments and disability. So we are doing here limit the disability. It is also called as disability prevention. Why? Because here what we are doing, limit the disability and impairment, and helps the patient to attain higher level of functional ability. For example, there are two modes of interventions in the tertiary prevention, that is disability limitation and rehabilitation. In the disability limitation, for example, the patient is admitted with a traumatic injury, and patients had so many fractures. We are giving physiotherapy to that patient to limit the disability and impairment. And in the case of rehabilitation, we are providing crutch walking to the amputated client, or we are providing with a prosthetic leg. And other examples are hearing aid, giving speech therapy to the individuals. These all are the examples of tertiary prevention. So, okay friends, today we have discussed about prevention and the levels of prevention. I hope this video will help you to make your concept clear. And if you have any doubts, you can write it in the comment box. And thank you for watching this video.